presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Case 12. Chief complaint. A 55-year-old male presents to the outpatient clinic with complaints of gradually worsening shortness of breath and dry cough over the past few months. History of present illness. The patient reports increasing dyspnea, which is difficulty in breathing, which now limits his ability to climb stairs or walk uphill. He also describes a non-productive cough. There is no sputum released. That has been present intermittently for the past 3 months. He denies chest pain, wheezing, or hemoptysis. Hemoptysis means when blood is present in the sputum. Past medical history: hypertension, type 2 diabetes mellitus. He is currently on lisinopril for hypertension and metformin for diabetes. Social history: he used to be a smoker, quit 10 years ago, does not use alcohol, and is a retired accountant. Father had a history of lung cancer. Physical examination shows BP 140 systolic, 85 diastolic, heart rate 78, respiratory rate 18, temperature 98.4. The breath sounds are decreased at the lung bases, but there is no wheezing or crackles in the respiratory region. He has regular rhythms and no murmurs in the cardiovascular region. Has a soft and non-tender abdomen, does not present with any edema in the extremities. Initial differential diagnosis: COPD, idiopathic pulmonary fibrosis, asthma, lung cancer, heart failure with preserved ejection fraction. Based on the steps, what do you consider the most likely diagnosis, and what further investigations or management steps would you recommend? If you're seeing my previous videos, you know what COPD means. If you don't, it basically means that from a very long time, there is some obstruction going in the pulmonary circulation in the pulmonary region, which causes the chronic obstructive pulmonary disease. Idiopathic pulmonary fibrosis basically occurs when the lung tissue starts to get thick, with increased severity, which means increasing thickness with time. The need for oxygen therapy, the amount of oxygen therapy also increases. Asthma, lung cancer whenever there is a mass of malignant tumor present in the respiratory region, especially in the lungs. Heart failure with preserved ejection fraction means heart is able to pump normally, but because the stiffness has increased so much, therefore the heart is not able to fill properly. Means the quantity of blood that heart can pump, the heart is not able to get that quantity itself. Likely diagnosis is chronic obstructive pulmonary disease. How are we going to confirm that out? We perform pulmonary function test. We'll do a spirometry to see the airflow limitation by checking out the forced expiratory volume in 1 second upon forced expiratory capacity ratio. We'll perform a chest X-ray to see the signs of hyperinflation, pulmonary vascular markings, and to see whether there are any other lung pathologies. How do we exactly find that there is hyperinflation? So in the X-ray, you will see that there will be a flat diaphragm. You can see in the X-ray, you could see a flat diaphragm. You could see lungs getting dark. You could see that the heart is more narrow and more vertical. These things show hyperinflation in the chest X-ray. We'll do a CBC to check for polycythemia. Why does polycythemia would occur in this case? Because it would be occurring as a compensatory mechanism. COPD could lead to chronic hypoxemia as to meet the oxygen demands. We perform an ECG to check for right heart strain or cor pulmonale, because it could occur in advanced COPD. What is cor pulmonale? Whenever the right ventricle fails to pump blood, which could be due to a lot of reasons. One of the reasons could be due to high blood pressure. Management will start start them on the bronchodilator therapy. It could be short acting, it could be long acting, so that we could obliterate the symptoms and improve the lung function. Hope you like the case study of today. You can come back whenever you want to sum it up. Please make sure that this is not a substitute of medical advice and is just for understanding purposes of how to diagnose and solve case histories. Corrections or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.